Good evening and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Patricia Bluette and I am the section's corresponding secretary. And joining me is Alice Paylor Days, and Alice is a member of our section's political committee. We thank all of you who have participated in our previous programs, and we hope that you will join us again today with your questions by calling 412 853 8206, and that number will be on the bottom of the screen. Our, our guest today is Jada Sherrill. She is the Chief Executive Officer of Healthy Start Incorporated. Today's program satisfies one of the National Council of Negro Women's national mandates to educate women about health and promote healthcare access. It also is for one of the other mandates is to support economic development and entrepreneurship, in addition to satisfying one of our Four for the Futures initiatives, which is to encourage entrepreneurship, financial literacy, and economic stability. Before we begin our program today, we'd like to introduce our special guest by reading a short bio. Alice? Okay, Alice, your mic is not on. Can you unmute? Okay. No, we still can't hear you. Are you unmuted? Okay. Well, I'm going to read her bio while we're trying to figure out what's going on with your technology. Jada Sherrill is the Chief Executive Officer of Healthy Start Incorporated, a public health organization focusing on improving maternal and child health and addressing the disparities that lead to higher rates of infant and maternal mortality among Black women and babies. In her 7 years of leadership at Healthy Start, Jada has deepened the organization's focus and impact on the community level advocacy, system level coordination, and elevating the voices of the women served. In her role at Healthy Start and in related community work, Jada strives to ensure health equality, equity, and remains at the forefront of all conversations. Now, Jada is a certified health centered design practitioner. She's trained in strategic doings, and she'll explain that a little bit later, and a certified lactation counselor. She is a graduate of the H. John Hines II College at Carnegie Mellon University and the Earl Graves School of Business and Management at Morgan State University.
Hmm.
Jada is also the owner of J. Sherrill Consulting and serves on the board of directors for the local grown Community Forge. Jada is a mother and a wife to three sons. In her spare time, she enjoys reading, traveling, and being a plant mom and spending time with family and friends. Welcome, Miss Sherrill, and thank you for being on our program today. Alice, do we have you yet?
Yes, I think I got. Do you hear me?
Yes, we do. Thank you.
Okay. Hello, Jada. How are you?
I'm good. I'm good
Good.
this evening. Thanks for having
Welcome,
me.
welcome to the show.
Thank
And
you.
where do you find time to travel? As busy as you are enjoying your job.
It's few and far between, but I do make time for a summer vacation every year. So if nothing
Okay.
else, I'm able to go somewhere once a
Okay.
week, once a year, 1 week a year. I find the time.
So what are the age brackets of the children of the families that you serve?
The children of the families that we serve are focused. So our services are focused prenatally. So we're supporting women and birthing people during their pregnancy.
Oh,
And then depending on what program a person may be in, we can serve the family up until the child is 3.
oh, okay. Okay.
Mhm.
And what are some of the services that you provide?
So, our mission at Healthy Start is to improve maternal and child health and to reduce poor birth outcomes and infant mortality. We are part of a national initiative that looks at the disparities in birth outcomes. So, in Allegheny County, we have a huge disparity for Black babies and Black women. So, if you look at data that tells you what our infant or maternal mortality rate is, and that's the death per thousand live births, you will see that Black women and Black babies are much more likely by a multiplier of 3 to 5 as compared to white women and babies to die. A Black baby is much more likely to die before his or her first birthday, and a Black woman who gives birth is much more likely to die within the first year of giving birth. And in both of these cases, many of these deaths are preventable. Many of these deaths are due to systemic responses, lack of response, lack of care, systemic racism. So that's the work that we do. So the services that we provide directly to families are focused on educating them around their health care, their rights, where they can go to seek services and supports, providing direct support, direct counseling, prenatal education, breastfeeding support and education, fatherhood support, providing opportunities for them to grow their advocacy skills should they need them. We have doulas, we have mental health clinicians. So that's the work that we do in the community space. We also do a lot of community education. Our goal is to really see communities that are more supportive, welcoming, and engaging for families to have healthy, for a woman to have a healthy, safe, and supported pregnancy, and for her children to live in a community that is safe and healthy. So it's important, for example, that we talk about safe sleep, not only with mom, but also with grandparents, aunties, and other caregivers, so that if mom has to leave her child with someone, they can be assured that they have the same level of information and knowledge to safely take care of that baby. As a public health organization, we know that there are things that culturally that we do that are cultural, that are just a part of how our community lives and navigates life. But sometimes from a public health standpoint, we see that the data tells us that those things may not be safe overall. So when we think about safe sleep messaging is a really good example. We want to put our babies on their backs, always put our infants on their backs to sleep. So we might have our elders in our community and our parents that say, well, you're fine, you live, we put you on your stomach, put the baby on their stomach so they can get some sleep. But now we know that when we look at it may have worked, I'm here, but there are babies that are not here. And we know that laying on your stomach contributes to SIDS. It's a risk factor. There was a time when we would put bumpers in cribs. So bumpers are the cushions around the sides of the crib. And for good reason, you don't want the baby against the hard slats of the crib. But we also now know that bumpers are a suffocation risk. We now know that there should be nothing in the crib with the infant. No bumper, no teddy bear, no blanket. So for many people, this is news. So the work that we do is around education, breastfeeding, even bottle feeding. We don't recommend that infants, at a really early age, get things placed in their bottles like cereal and things like that. We promote breastfeeding as a public health imperative. So sometimes our families struggle with the messages that they receive from a public health standpoint and the other messages that they receive in community. We also do a lot of advocacy and systems change work. So what that means is, we live our everyday lives in our communities, but there are forces that that are working against us: policy, laws, lead in our waters to make things very tangible. We have governmental institutions that are killing us. We have health institutions that are killing us. So we work to make sure that community members are more aware and able to navigate their experiences with these institutions, but also try to equip our moms who go through our program to be able to be change agents in their communities and as it relates to some of these institutions that they have to navigate.
Something that you just said, I want to ask this question. It pertains to the bumpers and the cribs.
Mhm.
So, are the cribs now designed so that the baby cannot slip through this, the different sections? Or I mean, I haven't looked at a crib for a while, so I'm
Mhm.
going to go to the store tomorrow and check it out. But are they designed that way now?
Yes, so they are designed differently. I can't give you the specs, but they are designed where the slats are closer together. There are
Mhm.
also alternative mesh that you can do instead of bumpers, but they are designed so that the infant cannot, you know,
Okay.
transition through to the outside. But we know that they get to the age where they crawl over top. But as a safety measure, they have changed the configuration of cribs. Now we give away pack and plays. So those are um, the playpens from back in
Mhm.
the day, but they're a little
Mhm.
bit more sophisticated now. And those can actually they're portable. They're pretty heavy, but they are portable, and you can safely put your infant to sleep in a pack and play. So it's really important that when we are providing education, that we're also giving our families tools that they may not have access to. It's important that our families have a safe sleep environment for their baby. A lot of families put kids to in the bed together
Mhm.
and think nothing of it. They think it's safe. They don't think, oh, I'm doing something where my infant can potentially suffocate. They're sleeping with their siblings, but that is a suffocation risk. So we want to make sure that we are providing the enabling support so that families can make good choices and they have good choices that they can make.
Mhm. Well, going back to what you were saying about laying the baby on their back or their
Mhm.
stomach, why is it dangerous to put them on their stomach?
It's dangerous to put them on their stomach because it increases the risk of suffocation. And we know that SID stands for sudden infant death syndrome. And as a society, we really don't know all of the causes of SIDS. We're not able to predict when an infant may succumb to SIDS. However, we do know that putting them to sleep on their back, it for one tangible example is it increases their startle response. So when you think about we even think about how you might enjoy a deep sleep on your stomach. Well, an infant needs to be able to wake up, to startle, and we don't want an infant sleeping for 8 to 12 hours. We want an infant to be, their body is just learning how to self-regulate. So that's one of the reasons, but we don't want that infant to suffocate,
Okay.
particularly if they cannot turn their head. And so since we're talking about safe sleep, it's really important that an infant be placed on a firm surface. So again, you don't want them to sink in. We think we like a soft mattress. Well, some of us do, but we want to make sure that the mattress that the infant is on is firm. Again, we don't want them wrapped in blankets. There are other things that we can use to make sure that the baby is warm at night. There are sleep sacks and other things that you can purchase, but we want to make sure that the infant is put to sleep on their back. Now, when they reach the age when they're able to turn over on their own onto their stomach, then you can leave them and allow them to lay on their stomach because they have the ability to turn their head. But an infant, a newborn, a baby within their first couple months, if their head gets stuck in that down in that mattress, they may not be able to turn their head.
Well, that's really interesting. There's some facts, and um, I thought I knew everything about raising infants, but that's wonderful information. But tell us, what inspired you to pursue a career in public health?
That's a good question. So I ended up in a career in public health, I think by chance. I was actually in the Healthy Start program with my first son, who's now 21. So I received home visiting supports with him. I received a nurse who came to my home at the time. I received breastfeeding support. I received support helping me to navigate different resources like baby equipment and supplies. So I had my time with the program. We closed out. My son was fine. He went on to grow and be big, and I thought nothing more of it really, until one day the job was posted, and one of my mentors, a former employee, said you should apply, and I did, and the rest was history. I've worked in the nonprofit sector for most of my career, and I've worked within organizations that serve our Black population in Allegheny County for the most part. So this was a great opportunity for me to grow in my leadership, to be able to work specifically with and on behalf of Black women, and on behalf of trying to promote and support our health and community building. And we really at Healthy Start look at how do we create a village through the services and supports that we provide, but also just in the mentality that we promote around what we as Black women need to be to and for each other, especially around the vulnerable time when you are giving birth and raising a child. So the public health piece of it, I'm really thankful that I'm within an organization that uses evidence-based and evidence-informed practice. And at the same time, we really have the opportunity to look at and investigate, is evidence-informed practice, how does it apply to us within the Black community? Because a lot of the evidence-based models that we see and that we use were created by and for white people. Can you all hear me?
Yes, we can hear you.
Okay.
Alice? Okay, I'm going to ask another question. How do you stay current on the public health research and the best practices?
A couple different ways that I stay current around public health research and practices. One is through Public Health Journal. So I'm a member of the American Public Health Association, and they have conferences, they have newsletters, and they send out a monthly publication. I have several staff on my team who are public health practitioners by training. They went to school for public health. Many colleagues who went to school for public health and work in the space of public health at the health department and other places. And in reading different journals and articles and just joining groups on social media. Social media is a great place to stay abreast of what's going on in real time, because that news generates in real time. But I really want to underscore relying on my team. I have a wonderful team at Healthy Start. And again, many of them we're a very diverse team as well. So we have community birth workers. I didn't go to school for public health. I went to school for public policy. So we have a really diverse team, but I do have public health practitioners on my team. But we, one of the things that we require of all of our staff is that regardless of what you believe personally, regardless of what has worked for you, for example, as you were raising your children, the information and education that we give our participants and that we give to community must be public health focused education.
Okay, sounds great. Can you describe a successful public health intervention or program that you have implemented?
Sure. So we've really expanded services over the last few years. In 2018, we began offering intensive breastfeeding supports to Black women we established a Healthy Start Center for Urban Breastfeeding. So we have always had to track and count breastfeeding initiation and duration among the women that we serve. So breastfeeding initiation is after that baby is born, if they have touched mom's, if mom has attempted at least once to try to breastfeed, then that mom counts as having initiated breastfeeding. Now, if she leaves that hospital formula feeding, she still counts as having initiated. So just as important as breastfeeding initiation is duration. So how long was mom able to breastfeed, either by directly nursing her baby, by pumping, even by supplementing, which is when you breastfeed and you give your baby formula. Any amount of breast milk is great, but as much breast milk as a baby or infant can get up and through their first birthday is really the gold standard from a health standpoint. So we really wanted to do more around how we could support Black women with breastfeeding goals. And in looking at what is going on in our community, what are the historical messages, what are the historical perspectives that create this gap where Black women just aren't breastfeeding at the rates that we would like to see and at the rates that we need them to. So we launched the Healthy Start Center for Urban Breastfeeding. We really decided to focus on, because the research told us that women stop breastfeeding or have the most trouble within those first couple weeks at home. So we created a 24-hour, 7-day-a-week on-demand service, meaning that if you just had your baby 3 days ago and you got home and you felt lost and didn't, things weren't going the way you thought, you could call our office and you could either talk to someone on the phone, you can get someone on a video call, or someone will come to your house and provide that support, again, around the clock. We have trained lactation support professionals. So there are different levels of lactation support training, but it's important that we have certified lactation professionals to be able to support our moms. So that's an example of one successful public health intervention that we were able to launch, is our Healthy Start Center for Urban Breastfeeding. And we have seen an increase not only, again, in breastfeeding initiation, but also in duration. Some of the barriers that we see for Black women in terms of their duration is having to return to work very soon after the birth of the baby. And that really creates a challenge for that breastfeeding mom, for her to be able to breastfeed as long as she would like to.
I can understand that. What strategies would you use to engage community members in a public health initiative?
So the Healthy Start initiative is founded on community participation. So nothing we do does not involve community. We have a community action network, and that is our community advisory group, if you will. And that community action network is made up of people who have been through the Healthy Start program, local business owners, local folks who are in the healthcare space, local folks who are in our faith-based community, and other concerned citizens. And what they do is they give us, they stay up to date and abreast with what we're doing, but they give us support and advisory on the scope of services that we provide and what they see as community needs, so that we can make sure that we remain connected to community and responsive to community needs. Our community action network is always recruiting, so visit our website if you have any interest in joining. And our web address is www.healthystartpittsburgh.org. We also have a program called Community Health Advocate Training Program. And in that program, we're focused on Black women who identify as single mothers. And we provide training on public health. We provide training on understanding health equity and how to continue to be a change agent in your community. So we find that a lot of the women that we serve and we know as Black women are already change agents. We're already advocating because we've had to advocate for ourselves, our families, and our children from day one. But how do we help them hone in on those skills so that they can be on community boards, so that they can pursue the educational endeavors that they want to pursue? So those are two ways that we engage community. Whenever we do a strategic planning process as an organization, which we do every 3 to 5 years, it includes community stakeholder feedback. And then across the span of programs, depending on what program it is, we have different ways that we keep community members engaged. For example, we have our birth plan, which is an infant health equity action plan. It's a very comprehensive plan that looks at how do we, again, secure a community that is more equitable and create space for Black women and babies to be healthy and to thrive, but not only at the community level, at the systems change level. And you can view and download that report on our website as well. But that infant health equity action plan was not simply created by our staff and offices. It was created in conjunction with and led by community input.
Okay. Now, in your bio, it says that you deepened the organization's focus and impact on community level advocacy systems, level coordination, and elevating voices of women served. Tell us how you accomplished that.
So, when I joined the organization, we were very much focused on our direct service mission, which is to provide in community supports for what we know as a home visiting model. So, we were very much focused on how do we support our moms through home visiting? How do we make sure that they get to their visits? How do we make sure we get them pack and plays and all of those things? But I really wanted to, the public health model tells us that we need to not only be looking at prevention, but we also need to be looking at upstream solutions and policy level solutions. And the Healthy Start Initiative calls us to do all of that. But if we are not, if we don't have the proper staffing mix to have staff who are dedicated to policy work, to have staff who are dedicated to developing programs that are focused on partnering with our WIC office, partnering with our local healthcare institutions. So I started to shift our resources and really begin to fundraise and have broader conversations with people about the impact that I thought that we can make as a community by not abandoning our direct service work, continuing to do that because that's where historically we're strong, that's what we're known for, but beginning to invest resources and beginning to staff up around having conversations and building relationships at that system change level.
Okay. Now, also in your bio, it says that you are a certified human-centered design practitioner. And also, what does strategic doing entail?
So strategic doing, so when we think of strategic planning, so I had mentioned strategic planning, a lot of organizations will go through this process of using tools to determine, what is our place in the market? What's our niche? Where do we see ourselves in 3 or 5 years? What are our guiding principles? And you go through this process of brainstorming, of getting together with your stakeholders, be it your board or other advisory committees, and really putting together a roadmap for yourself as an organization over the next 3 years. And depending on, your organizational leadership, either you really live out and continue to keep that roadmap in the forefront, or you put it on the shelf and say, we did it, check the box. We'll do this again in 3 to 5 years. Well, strategic doing, so strategic planning results in a plan. And in order to get from point A to Z in that plan, you have to have action steps. Strategic doing is really about breaking down a really big strategic goal into action steps through a prescribed process. So if you had a really big goal to get a certain degree, so that the strategic plan might say, your action items are to apply for a loan, to study for the admissions test and all of these things. But strategic doing really breaks down those steps of within the next 30 days, I am going to do this. And then after you do that, you break down that next step. So you go from A to C, then you go from C to F, so on and so forth. So we were kind of having a conversation before we started about a leader who's a big picture person and really needs someone on their team who is detail oriented and who's action oriented. And so the difference between a strategic plan and strategic doing, or strategic planning and doing, is strategic planning is that big picture vision, and strategic doing is those action items that get you there, but you take it in chunks.
Okay. Sounds great. And thank you for helping us solve that other problem that you just did. Okay. What is your experience with grant writing and second funding for public health projects? I'm sorry, and securing funds for public health projects?
Sure. So my career actually started in fundraising. So I after Morgan State University, and let's give a moment of silence for our family at Morgan State University in Baltimore, given the tragedy, the tragic shooting that occurred a couple of days ago, and unfortunately canceled homecoming for student athletes and alumni who have worked so hard to have that time once a year to come and celebrate a wonderful HBCU. So it's really sad with what's going on in our world. But after I finished at Morgan State, I wasn't quite ready to go into the working world, and I looked into going into graduate school. So I came back home, went to CMU, had my son between my first and second year, but I also got an internship at the school through their HR department was doing an internship program for students from HBCUs. I don't think they have it anymore, but I was able to go through it. It was a really great experience. And so while I was there as a student, I did an internship with the College of Engineering, worked in alumni relations, and did some projects and developed really great relationships with folks. And so when I graduated, again, this wasn't my intended career trajectory, but I was hired by their institutional advancement department. And my first job out of college was to be a prospect researcher. So my job was to look up people who were wealthy, most of them were CMU alum, and find out every personal thing about them through these really high-powered databases so that the gift officers would know how to lead the conversation and asking them for money. So these databases would tell me, so-and-so's net worth, so-and-so has a boat, so-and-so owns 5 houses, so-and-so has a business that is worth this much money. And then I would have to write a profile, and the profile would go to the gift officers, and the gift officers would use that to solicit gifts. I was having this conversation with someone else the other day when they asked me about like how you get into nonprofit fundraising, or what were some of my insights about nonprofit fundraising. And very different from nonprofit or even other public sector fundraising efforts, when you go to when you're part of a fundraising team at a university, when you go to school, the school grooms you to be hopefully a successful alumni who knows that they should give back. So a lot of money is invested in the advancement is another word for the whole fundraising operation at a university, because you're grooming your donors while they're there as students. So it's a very great place to learn some fundraising fundamentals. On the nonprofit side, especially in human services, you're relying on people who don't necessarily have a personal affiliation with the cause to give. You're relying on them to be charitable and give out of the goodness of their heart. So it's very different. So when I'm talking about about Black infant and maternal death, I'm not so much relying on the families that we serve to give. I hope that they choose to, and many of them can give, but we're also relying on people who may not have a personal experience with this particular issue, but who think that the issue is important and who want to support it. So that's just kind of, I've been doing grant writing and fundraising in various facets for over 2 decades. Immediately prior to coming to Healthy Start, I worked in development at Gwen's Girls and Every Child. So grant writing has been a part of my professional life for a really long time. It's thankfully something I enjoy, but it's also something that I've been able to step away from a bit as I've been able to build my team and have someone on my team who actually can focus on the grant writing. When I started at Healthy Start, I was writing all of the grants. Then over time, I had some of my directors who were supporting, and they were learning grant writing as they supported. And now I probably would say I do less than 20% of the grant writing, which is great.
Okay, that's great. That's
Mhm.
great. That's great. That means that you, as a leader, are teaching your staff how to step up and take responsibility. That's great.
Mhm.
Tell me, in your opinion, what are the most pressing public health issues facing our society today?
Oh, that's a really big question. Um, Healthcare and disease is, they're two very interrelated, and especially if our audience is primarily Black women, we know that we bear the burden of a lot of disease, whether it be heart disease, which is a large killer of Black women, whether it be coming into pregnancy or developing preeclampsia during your pregnancy, which is a form of hypertension that develops because of pregnancy. Um, our healthcare, so our healthcare costs, that's a public health crisis. lack of access to
Mhm.
healthcare. And access can mean you can have health insurance, but it's not working for you. You can't, we have two big healthcare providers in our own community where you may have one type of health insurance but you can no longer go to your doctor because of decisions that our executives within those institutions have made because of money, not because we care about people getting the best care, but because of money. So those are the two that come to mind. I mean, there are so many violence, community violence is a public health crisis. Lead in our water is a public health crisis.
Mhm.
Lead in our water for our children and our babies prevents their development. It stymies their development. And then we wonder why we have, adults in community that have severe mental health problems or have severe learning disabilities. Just a few years ago, it was national news that there's arsenic and all kinds of other heavy metals and chemicals that are in baby food.
Mhm.
Powdered formula may contain a bacteria that can kill you.
Mhm.
Our food supply is killing us. So many public health issues. Not having adequate time for maternity leave as a society. We're the only country that the developed nation that has, as an employer, you don't have to provide any kind of maternity leave.
Mm. Interesting, very interesting. Have you ever faced any ethical dilemmas in your public health work? And if so, how did you handle them?
I think there are lots of ethical dilemmas that come up in this work. So couple specific ones. We as an organization promote and try to make sure that to the extent that we can, that Black people are involved in research that impacts their communities. So we partner on a lot of research that we feel will benefit our participants, that we feel is relevant to and will benefit Black women, because we know that if we don't get participation in this research, that the research will carry on, because research is big business and it will be done without us. So making sure that we're looking at the institutions that fund the research a lot of times do things that are objectionable. Folks that give us money as an organization, they do things that are objectionable. However, we can take that investment and do good with it. We can take some of the objectionable things that people or practices that folks may have had, and through working with us, give them a new perspective on what it means to be community centered. So we've really, I would say, we've had some breakthroughs with some of our research partners in terms of what they perceived as community engagement, and in their experience of learning what community engagement really should look like. They now have a new standard for how they engage in community. We launched a program with the Allegheny County Department of Human Services we launched it right before the pandemic. So it would have been early 2020. Some of you may have heard of it. It's called Hello Baby. It is an initiative to make sure that all babies that born in Allegheny County are supported. All families of babies born in Allegheny County are supported. And when the RFP came out for that initiative, I thought it would be a great opportunity for Healthy Start to utilize our longstanding expertise in supporting families and women during the perinatal period. So during their pregnancy and immediately postpartum. And the population that we're focused on within this program is families with complex needs. So complex needs may be past CYF involvement. It may be complex mental health issues. It may be other complex needs for social support. And so the ethical dilemma was, as an organization that is a community-based organization, that's not really tethered to like CYF, for example. I mean, all of our staff are mandated reporters. I'm a mandated reporter, but we are a standalone community-based organization. So I really wondered, while this would be a good opportunity for us to grow our footprint and to make sure that families were served in a way that we thought that they needed to be served, would it be perceived by community that we somehow had a different relationship with DHS and CYF? Because I think when people in community, when we think of DHS and families and how they serve families, we automatically think about CYF. And then we automatically think about the way that our systems target, harm, and traumatize Black families and hold them to a different standard. But and so I talked to our participants, I convened some community members, and I said, hey, should we apply for this opportunity? Is Healthy Start the right organization to provide these supports to families who are referred into this program with DHS funding? And overwhelmingly, the response was, yes, we should do this. Yes, we would like to see Healthy Start serving community in this capacity. So part of our charge in doing that, and we were successful. So we serve very high-risk families who are referred. And so it was great to know that community members saw us being able to serve families in that way. But also one of the things that we wanted to be sure to look at was, are you disproportionately referring Black families to this program? What is the disproportionate impact? And how can maybe we use this program? Because the whole idea of the program was to serve families in a different way, to be upstream prevention, to prevent child abuse and neglect, and to prevent Black families from coming into the child welfare system at a disproportionate rate. And so our goal, in knowing that that was the overarching vision of the program, was to really try to keep the conversation at the forefront, as many folks have done, all this time. Lots of my mentors, Dr. Sharon McDaniel, Trisha Gadsden, Jesse McLean have tried, and many, many others have tried to do the same things. And we just wanted to be sure that we were carrying that message of, we want to do this work, it's important, but we're not going to stand for being a part of disproportionately exposing Black families to the child welfare system.
That sounds wonderful. Hey, what are some key considerations when designing a public health communications campaign?
So I think the first key consideration is it evidence-based? Is it data-based? Is it based on some kind of science? And it's important to break down that evidence, data, and science in ways that community members can understand, and providing options for your communication, and making sure that you're communicating at a level where people can understand. A lot of times when we bring community members into these conversations, when we bring community members into our research, then we need to make sure that there's adequate time put in so that people at all levels can understand what's going on. Can't use all this jargon and acronyms and things like that. We have to make sure that we are being welcoming and inviting to community members. So our communications need to do the same. They need to be fact-based and they need to be evidence-based, but they also need to be welcome and inviting and culturally humble. So we don't use the word cultural competency. We like to use the term cultural humility, which is coined by several Black women doctors, and it really focuses on cultural humility as an ongoing journey versus trying to master someone else's culture.
That's great. How do you handle situations where political factors may influence public health decision-making?
I think that's a day-to-day reality that's inevitable. I think so. First and foremost, I have people on my team that help support me in understanding and navigating the political factors that we need to be paying attention to. I also lean on some of the elected officials that I really admire. So in Southwestern Pennsylvania, we have some Black women who are doing the daggone thing, who are doing great things to keep equity at the forefront, to keep Black women's issues at the forefront. So, Summer Lee, Latasha Mays, and so many others, they happen to be my sorors. And I'm just so proud of them, but I lean on them and I follow their work and I look at what they are doing. And when I have questions, it's nice to have someone close and near and dear that I can reach out to, because the political system is definitely made to, and this is just my opinion, is definitely made to fatigue and exhaust you. It's made to distract you. And it's made to, as we know, keep some people rich and some people poor, and some people healthy and some people unhealthy. And we see that at the community level.
Okay, great. I understand Alice got her situation straightened out and she's coming back to join us again. Hi, Alice. Welcome back.
Thank you very much. I wanted my cell. I don't know what happened,
Okay.
but
Hey, technology, don't even ask me. That's not my forte.
okay.
Okay, we're on actually number 18, if you want to go to that question, Alice.
Well, no, go ahead. I'll catch up.
Okay. Or you know what, I think we've been getting a great education, and I can understand why you're the executive director. You have so much knowledge, and the information you're sharing with us is wonderful today. How do you ensure that the voices of marginalized communities are heard and considered in public health initiatives?
So first, for me personally, by taking opportunities like this to share and give my story and my perspective, and make sure that people are aware of not only the work that Healthy Start does, but the issues that we address and why those issues are issues. We also hire, so we use a hiring model where we value and prioritize lived experience. So what we hear from our Black mothers is they want a mental health therapist that is a Black woman or a Black person. They, for their children, if they have a little Black boy, they want a mental health therapist that is a Black male. They want to find a Black OBGYN or dermatologist. So it's that commonality that, and not to say that, you know, all Black people are the same. We're not, but we want to be served by someone who we know will understand us and who will see us. And so we hire very qualified, very smart, dedicated, passionate, and well-trained people who reflect the communities that we serve. So that, I think, is first and foremost how we make sure that the voice of community is elevated. And then whenever we have opportunities, be it a legislative visit, be it a meeting with a funder, or just making a video that highlights our work, we give that opportunity to our participants to be centered in that. When we are developing new programs, I talked about our strategic planning process, we make sure that we formally capture the voices of our participants. And to make sure that we are able to do that, we make sure that we provide compensation. So we know that, you know, I do this because I love it, but I do it for a paycheck, you know, keeping it 100. It's my job and I do it for a paycheck, and I don't expect other people to contribute to what I'm doing for free when they have to sacrifice their time away from their families, you know. So we make sure that we are paying Black women for their labor and their expertise, whether it's to say, come together and give us some ideas, or when we're contracting for services, again, we look for that lived experience that reflects the community that we serve.
Oh, it sounds
And I
great.
don't know if you've addressed this or not, but how do parents find you, or how do you find your clients?
So in a number of ways. So we've been in community for over 30 years. So a lot of people know about Healthy Start, but a lot of people don't. Word of mouth is the number one way that we seek that we get new participants. We also get repeat participants. So we might serve a family through multiple pregnancies. We get referrals from doctors' offices. We also do a lot of tabling and community outreach. And then we have people that just, you know, stumble upon our services because they were looking for something and they Googled it and they found it. But our main sources of referral are word of mouth and through our medical partners and our other social service partners. So if we have someone, so like I had mentioned earlier, WIC. So maybe we have a pregnant woman who has signed up for WIC and may not know about Healthy Start, but WIC provides that referral.
Oh, okay.
Great. I don't want us to run out of time because I know you have an event that's coming up tomorrow. Can you share that with us?
Yes, thank you for bringing that, because I would have just talked. So tomorrow, from 11 to 12 in recognition of October is Pregnancy, Infant, and Child Loss Awareness Month. We are doing a walk. And the walk is called Walk a Mile in My Shoes. And again, it's to raise awareness, but also to take a moment and think about those who have had a loss. Pregnancy loss, infant loss is not uncommon. It's not something that we like to talk about because it's unpleasant and it's sad, but it's not uncommon. And we just want to take the time to raise awareness that there is support out there, but also we don't want to keep having to talk about preventable deaths. We don't want to keep having to talk about deaths that occur because of lack of adequate care or lack of adequate resources or lack of adequate knowledge. So the walk is happening in Wilkinsburg at the Park Avenue Playground. Again, that's tomorrow, Saturday, October 7th from 11 o'clock to noon.
Okay. Alice, did you have any other questions you wanted
And
to bring up?
These will be parents and staff walking.
Anyone who feels so inclined. So yes, it will be staff, it will be parents, it will be community members who believe that this is a good cause, who believe that we need more community awareness. If you just need to get out and get your steps in, please join us. If you're looking for something to do, if you're looking for an organization to connect with, please join us. And this is a part of our Wilkinsburg walking route. So we do have an initiative at Healthy Start that's specifically focused on making Wilkinsburg a healthier community for infants and babies. And their parents. And so as part of that, we host walks every other weekend and we do it year round. So during the winter time, the walks are going to be come inside. The best way to stay up to date with that initiative is to follow us on our social media platforms. We are on Facebook, we are on Instagram. And my marketing and comms people would kill me because I'm like, are we on? The social media is not my thing. They know that. But look up Healthy Start Pittsburgh, Healthy Start Southwestern PA. Follow us, and that's the best way to stay up to date with all of our activities.
And
So anyone will. Right, I'm sorry. Go ahead.
No, it's going to be tomorrow from 11 to noon. And where's it start at?
Park Avenue Playground, which is on the address is down the bottom, but it's on Park Avenue. So it's right behind the Jamaican restaurant.
Okay.
Royal Caribbean. Right behind Swiss Montier Street.
Okay.
Well, you know what, Alice, since I've been doing most of the talking, I'm going to allow you to do the closing. So please,
okay.
Be my guest.
Well, I missed a lot of it, but I will try to come tomorrow and learn more about the program. But I'm sure your information was very knowledgeable and very important for people to hear. And
I learned a lot too, just sitting here and listening. It was very interesting. And as I said, they have the right person in your role because you really shared. And she's saying it from the heart. It's not even like something like she's rehearsing. She knows this. She's living this. And she shared quite a bit of information with us. But before we thank our guests, go ahead.
No, I was just going to say, I'm sure that it sounds like just from listening to you that it's very rewarding for you, your job.
Absolutely. That's the most important thing and that's the thing that makes me feel the best when I'm in community. And there's always someone who is either in the Healthy Start program or who worked for Healthy Start or who knows someone who worked for Healthy Start. And then occasionally you'll get that person that has that, heartfelt story about how the support was really changed their life and really helped to put them on the trajectory that they needed as a parent.
Okay. Well, Jada, we'd like to thank you for appearing on our program. And we'd also like to say that the Good Health Women's Immunization Network, in other words, Good Health Wins, is our commitment to building an army of good health champions who understand the importance of immunization across the lifespan. Through our network of trusted messengers and grassroots activities, our goal is to increase vaccination rates, help remove barriers, and increase access to vaccines and good health. Alice, do you want the next part?
And yeah, and I want to just thank you so much for your time, because you sound like you're a very busy person,
Mhm.
and it's been very informative.
Okay.
Thank
And
you.
we also would like to thank our listening audience for tuning in. And we invite you to join the National Council of Negro Women by calling 412 867 9641. That's 412 867 9641 for a membership brochure. And we need your help to educate, advocate, and positively impact the community in our area. So thank you so very much, Jada. And
Thank you for
in the
having me.
in the Rankin-Mon Valley, Pittsburgh area, remember our program airs on the first Friday of every month at 6 o'clock. And remember, get vaccinated. Thank you so much.
Absolutely. Thank you.